Welcome. CDC Director Jim O'Neill is calling on vaccine makers to split up the combined MMR vaccine. In a post on X yesterday, O'Neill endorsed President Trump's earlier call to split the measles, mumps, and rubella vaccine into 3 separate injections. The post came just hours after O'Neill signed off on a vaccine advisory panel recommendation against getting the vaccine before the age of 4. Let's bring in NBC News medical contributor Dr. Vin Gupta. Doctor, what would be the problem with this suggestion to split them into 3?
Morning, Mika. Good to see you. Unfortunately, there's a reason we do this. The 3 shots, measles, mumps, and rubella, across not just the United States but the world. Places like Australia have never even adopted or had separate monovalent or single shots for these infections for a reason, because it's very safe to combine them, and there's no issues with effectiveness. What's the worry here is, despite the lack of evidence, they're pursuing this. Looks like the acting director is rubber stamping what the president put out. Just a week and a half ago, you and I had that conversation when he put that message out. But number one, confusion is just rampant. They have one primary job amongst many, but their primary job is clear communication to the American people on what they need to do to keep their families safe from health risks, and they're doing a terrible job of that. This is just causing rampant confusion. Number two, this is going to leave kids unprotected for longer. If we're saying now pharmaceutical manufacturers have to develop 3 separate shots, that means, and space them out according to the president, that means longer periods of time will go where kids are not protected against what are very dangerous infections. And also, what kid exists? I mean, I'm a father to 2 young kids. I'm sure we're speaking to many parents out there. What kid wants 3x the number of shots? No kid wants 3x the number of shots. We are trying to minimize the number of shots here. So from a disease prevention standpoint, let's root out these diseases as efficiently as possible, and let's minimize needles. And to put, as the president put it, he was worried about the amount of liquid we would be giving quote unquote kids. This is actually giving them more shots and more volume of quote unquote liquid. So that none of this makes sense.
So, Dr. Gupta, just to put a fine point on this, other than the whims of the President of the United States giving medical advice and the man he chose to be the head of HHS, is there any reason medically to separate these shots?
No, there is not. And, Willie, I had a chance to speak to some leading pediatricians yesterday in their society. And what they're telling me is no pediatrician's office or medical provider's office currently has bandwidth to care for all the need out there. How are they going to be able to care for 3x the number of vaccine visits? It doesn't make any sense.
All right, another change, Dr. Gupta, the vaccines for people 65 and older, but this first, Republican Senator Bill Cassidy of Louisiana, those new guidelines. Senator Cassidy, who's chair of the Senate, for people who want to get the shot. Senator Cassidy, many fewer people will get the vaccine, and that's not. The Louisiana senator continued, quote, screw with the American people's health vaccine. Your response to
Well, I agree with Senator Cassidy. The COVID vaccine has become political, and they keep using this term shared decision making. They use it when it benefits them. So let's be clear here, Willie. When it came to, we just talked about the measles, mumps, rubella vaccine. A few weeks ago, we were talking about measles, mumps, rubella, varicella added for chickenpox. They said that parents and their pediatricians did not have the ability to talk about that combination shot. They took away the agency of parents and providers to give that vaccine. through shared decision making. Here, what they're saying is talk to your provider before you get the vaccine. So they're contradictory. If you have to first go and speak to somebody before you get something that we just recommended you get under certain conditions beforehand, of course, it's a barrier because 1 in 2 Americans do not have regular access to medical care. It's a problem. They're maybe going to make it worse with a government shutdown. So how do you actually get the vaccine if you qualify, if you don't have durable access to health care? That's the issue.
So, Dr. Gupta, you just mentioned it. We're now a week into this government shutdown. What are some of the consequences for the nation's health care now, and would they grow the longer the shutdown lasts?
Yeah, Jonathan, maybe the easiest way to talk about this is through just 2 quick examples here. If you have an individual that's making $28,000, they will pay up until now about 1% of their income, about $300 in annual healthcare premiums to get a benchmark healthcare plan through the Affordable Care Exchanges. With the enhanced tax credits, this is what we're talking about here in this government shutdown. Enhanced tax credits passed in 2021 by the Biden administration. If they expire, which is the proposal from Republicans, that individual who makes $28,000 a year, Jonathan, will pay $1,500 in healthcare premiums, 6x. For the family that makes, say, $60,000, their premiums are expected to go up to $22,000, an increase of over 10%. So this is a major increase in healthcare premiums for over 24 million Americans. So that's the big issue here, Jonathan. Affordable access to healthcare. A lot of people no longer being able to afford healthcare is going to be the concern.
So, Dr. Gupta, back to vaccines. Instead of the 3-in-1 shot, how long would it take pharmaceutical companies to package 3 different vaccines and get them to market?
It's great. That's a great point. Currently, these do not exist as monovalent individual vaccines. And so that's the question here is how long is this going to take to produce? Number one, we saw Operation Warp Speed for the COVID vaccines took still many months. And so now you're talking not just about a ramp up in manufacturing, but also who's going to fund this? Mm-hmm. No pharmaceutical manufacturer is going to say, "Hey, let me do something that all the medical societies across the country and across the world are saying. Why are we doing this? One, so why would they do something for which there's maybe a 2 to 3 year appetite at the federal level to do? And number two, we're talking billions of dollars here. Who's going to fund that? The American taxpayer."
All right, NBC News medical contributor Dr. Vin Gupta, thank you so much. We appreciate your insight this morning.